It was, well, living in Pakistan 30 years ago when I started my career that I first began to realize the importance of infant feeding and breastfeeding and the effect that that had on the health and survival of children in settings like that where there are high rates of infection and disease. And later working in other countries, Kenya and Nepal, and especially in Nepal where diarrheal disease and respiratory infections are very common, understood again the impact of infant feeding on the health and survival of children in those situations. It was then that I began my commitment, a long-term commitment to working on infant feeding. Over the last decade or more, we've also learned a lot about how to implement programs that affect infant and young child feeding through interventions at the community level that focus on changing attitudes and practices of mothers and families, of training frontline health workers, and also implementing or enforcing policies that already exist relating to infant feeding, as well as behavior change, mass media education, and then documenting those changes. We've also learned the importance of the critical period of the first 24 months in the life of an infant and how that affects the outcomes for years to come. We also have the endorsement recently of the Lancet series on nutrition, which focuses on both breastfeeding and complementary feeding as key preventive interventions and endorses the importance of these in saving infant lives. In Alive and Thrive, we have the opportunity to build on the programs and the successes of the last 10 years or more in taking the lessons learned to scale. At the same time, we also have the opportunity to test innovations and take some risks to try new program initiatives that hopefully will have long-lasting effect on infant and young child feeding. For me personally and professionally, this is a very exciting time to be working in the field of nutrition, and particularly in infant and young child feeding. We have the opportunity to work with the most vulnerable groups, infants and young children in these countries, who are the future and the hope of not only their families but also their communities and their nations. And we should do everything that we can to ensure their health and survival.